Now we're going to start talking about the knee. This is the first part of our knee um, presentation. In this presentation, I'm just going to provide a quick overview of our knee anatomy. Just so you know, an FYI, the knee is one of the most complex joints in the body. Um, Doctors and athletic trainers, physical therapists, and a lot of other healthcare providers spend a lot of time helping people with their knees. The knee is designed to provide stability in weight bearing, so when we walk, and mobility in locomotion. That means locomotion means walking, running. It's how we move around. So, our anatomy, we're going to start with our bones. Our first bone is the femur, which is the big long bone in your thigh or the upper part of your leg. And it's the strongest bone in the body. It's a very big bone. As you can see in the picture on your left, we have the tibia again, like we had in the lower leg and the ankle. We have the fibula, which is on the lateral side, and the tibia is on the medial side. And then we have a patella, which is your kneecap. A little tidbit of information about our patella: it's the largest sesamoid bone in a body. A sesamoid bone is a bone that floats in a tendon, and that's basically what the patella does. The patella is basically our built-in knee protection to protect our rest of our knee. Again, it protects the knee from anterior or top of the knee from injury. So now we're going to talk about our knee joints. The knee joint itself is called the tibial femoral joint. It is comprised of the tibia. So if you look at the picture, you see the flat part of the top of the tibia, the condyle of the tibia. We have then the femur has lateral and medial epicondyles. The rounded bottom edge of the femur rolls on the tibia and allows us to do flexion and extension. So flexion is when we're bringing our heel to our rear end, and extension is from when we extend it out. So that starts with, if the leg is just straight, that's fully extended. And so flexion extension. Our patellofemoral joint, or the PF, is where the patella and the femur articulate or touch. It doesn't really have a range of motion. It just slides when we do flexion extension with our knee. Now we're going to talk about our range of motions and muscles. So knee flexion is done with our hamstrings and gastrocnemius muscles. So hamstrings, as you can see in the picture there again, we're on the posterior, the back aspect of our knee. We have the bicep femoris, and it has a short and long head. You don't need to know that too much, but the bicep femoris, the semitendinosus, and the semimembranous. So there's three hamstring muscles, and those do knee flexion. And then we have knee extension, which is done by the quadricep muscles, which is a group of four muscles. We have the rectus femoris, which is a really long muscle, starts up at the top of the hip and goes all the way down into the patella tendon. Then we have the vastus medialis, which means it's on the medial side, the vastus lateralis, which means it's on the lateral side, and the vastus intermedius, which means it's in between those two muscles. And that makes up our quadricep group, and that's all on the anterior part of our thigh and our knee. As you can see in that picture, one thing I didn't put on here is I already said it, the patellar tendon. You'll see on the picture it calls it a ligament. It's primarily known as a tendon, and the quadricep group turns into a tendon. You'll see in the picture it says quadricep femoris tendon, surrounds the patella, turns into a tendon, and it connects to our front of our tibia at the pes anserine. Oh, that's incorrect. I forget what it's called. Tibial tuberosity. Sorry, that's where the uh, patellar tendon attaches to. All right, now we're going to move on to ligaments. The cruciate ligaments. The word cruciate means cross, and so they cross each other. In our knee, they're pretty deep inside the knee. The one that's most commonly known is the ACL, or anterior cruciate ligament. So it means it's on front of the knee. It starts at the front of the knee. It's the most commonly injured ligament in the knee. All have probably heard about ACL tears. We're going to talk about that in the next presentation. So what it does is it keeps the tibia from moving anteriorly or moving forward, from it sliding forward as you're standing up or have your knee bent while you're sitting. The tibia should not move forward at all. That's what the ACL does. Now the other one is the posterior cruciate ligament, the PCL, and it's the strongest ligament in the knee, and so it prevents hyperextension of the knee, and it also limits the tibia from going backwards of moving posteriorly. So again, if you're sitting at your chair, you should not be able to move your tibia backwards. So we have two collateral ligaments. That means they're on the side of the knee. So the first one is the medial collateral ligament, or the MCL. And so as you can see in the picture, obviously it's on the inside of your knee, on the medial side of your knee. And it limits lower leg from being abducted. That means it keeps the tibia and the lower leg from moving out. That's what abduction means. It means moving away from the midline. And it also limits external rotation, so that motion is with your knees bent, rotating your foot out. The next one is lateral collateral ligament, the LCL, and this one limits lower leg from being abducted or adducted, and that means, I think I made a mistake. The abduction or abduction means the lower leg is moving away from the midline. I can't remember what I said now. Adduction means it's moving towards the midline. Or it's being added to the midline. It's the way I always think about adduction. It's being added to our midline. And it limits internal rotation. So if your knee's bent, like you're sitting, and you rotate your foot in, that's internal rotation. So that's what the lateral collateral ligament is limiting. The next structure, or last structure we're going to talk about, is the menisci, or the meniscus. These are cartilage that provides or makes the joint deeper, so that femur can roll on the tibia, so it sits on top of the tibia. And it also provides shock absorption, so every time we walk, we have some kind of way that the force is dispersed in our body. It also provides some knee stability, or adds to it. So we have two. We have the medial meniscus and the lateral meniscus. So obviously the medial meniscus is on the inside area, and our lateral meniscus is on the outside. They go all the way around the knee, so they're on top of the tibia again. And we'll talk about injuries to those particular structures. So just quick review, we talked about the knee anatomy, bones, the femur, the tibia, the fibula, and the patella. Talked about the joints, the knee joint, the tibial-femoral joint, and the patella-femoral joint. Talked about our muscles and range of motion, knee flexion and extension, hamstrings, quadriceps, the ligaments, the ACL, PCL, lateral and medial collateral ligaments, and our menisci, the medial and lateral meniscus. In our next presentation, we'll talk about all the different various knee injuries.